Hello, my name is Evan Keller, and I will be administering medication via piggyback. Initially, I will adhere to the 6 rights of medication administration, namely right patient, right medication, right dose, right route, right time, and right documentation. I will use the 3-check method, wherein I initially look at the physician's orders and then compare them against the MAR. In this case, I will be administering 560 milligrams chloroform IV piggyback every 8 hours. I have a reconstituted bottle that is 500 milligrams per milliliter, and I am to place it in 50 milliliters of 0.9 saline and infuse it over 45 minutes. Because of this, that comes out to be a rate of 67 milliliters per hour, and the drop factor is 10, so that would come out to be 11 drops per minute. Because it is there's 500 milligrams per milliliter, and I'm to administer 560. After doing the math, that would come out to be 1.1 milliliters of chloroform that I will draw up in my syringe to administer into the piggyback. I will start by ensuring that I have the 50 milliliters of 0.9 saline and that I have the right medication. I will ensure that there's no discoloration or particulates in the fluid. I'll also check the expiration date on both the medication vial and the piggyback. I will ensure that I have all the right supplies. Once I've ensured that I have the right dosage and everything for my medication, I will grab a pen and label the pertinent information on the piggyback, namely the patient's name, the drug, the amount of drug, the date administered, the start time of the infusion, and the time the infusion is supposed to end. And I will then I will acquire my medication vial. I will use an alcohol swab to cleanse the top of the vial. And then I will take my syringe and I will withdraw 1.1 milliliters of air and place it in there, and then withdraw 1.1 milliliters cap using one-handed technique. Oh, get away from me here. Then I will remove the tubing. I will close the roller clamp. I will remove the portion where the spike will go in, making sure, I will cleanse the end of that. And then I will remove the spike, making sure to maintain sterile technique. I will cleanse the end of the spike. No, I'm not supposed to do that. Will you pause it?
Go.
Okay. I will uncap my needle, and I will inject the medication into the port of the bag. Cap the needle. And then I will mix the medication in the bag. Then I will remove the cap. Make sure not to touch it. I will remove the spike, making sure not to touch it. I will take an alcohol swab. And swab down to the port. This. Then I will open the clamp. Started.
Mm-hmm.
Prime. Just filling it halfway. And then take lower my main line. Then open, lower the clamp. Then I will determine that I am to have 10 drops per minute. So I'll use my main line to adjust the rate. Clock. And then I will, once the medication has all infused, I will close the roller clamp, its original height. I will remove the tubing. And then I will use the roller clamp to resume the initial 28 drops per minute of the main line. And then I will wash my hands and say my farewells to the patient. And then I will leave the room and document all the pertinent information, namely the type of medication, the rate of infusion, the drops per minute, the date, the time the infusion started, the time the infusion stopped, and then I'm done.